Hey, Dr. James here. So here's a question I get all the time. What is spinal stenosis, or what causes spinal stenosis? And this is an important question because a lot of patients, if you're in your 60s and 70s, and we see a lot of patients who are in their 60s, 70s, 80s, even some in their 90s, believe it or not, and they're diagnosed with stenosis. And I'll say to them sometimes, well, what's causing the stenosis? And they look at me like, well, the stenosis is causing the stenosis. So let me grab my little model here. If you look at this spine here, like this is belly up, back down. This opening here where you see this yellow thing is your spinal canal, and that yellow thing represents your spinal cord. So when the doctor says you have stenosis, it means that that canal is getting narrowed. That's all it means. So stenosis means a narrowing of the canal. Now what can cause a narrowing? Well, you can have a disc herniation like you see here, narrowing the canal. You can have a disc bulge that can narrow the canal. You can have the facet joint in the back behind the nerve root thickening the canal. You can have a cyst around the facet joint thickening the canal. You can have a fatty tumor, which we see fairly commonly, called an epidural lipomatosis, a big word for a fancy term rather for just a fatty tumor that can occupy some space. You can see the vertebra shifting forward or shifting backward, and that can cause stenosis. You can have a bone spur in there, and frequently what we see is that patients have a multitude of things going on that are causing the stenosis. But really, if you have spinal stenosis and it's not caused by just plain old bone spurs, then non-surgical decompression and the other modalities that we use have been super effective in helping you get out of pain and getting your legs strong again and being able to walk again. A lot of patients with spinal stenosis don't even have any back pain. All they have is leg issues. A lot of them do have a lot of back pain, and they got to walk on the shopping cart in the grocery store because they got to take the pressure off of their back. But if that's caused by a disc bulge or a disc herniation or facet thickening, then the procedures that we utilize in our office are really wonderful in helping you do that, and there's little to no risk with it. So I hope that helps you understand a little bit more about what stenosis is. It's a blanket term that's used by a lot of doctors, but you need to understand what's causing it to understand what would be the best therapy. Thanks.